We'll look at the classification of drugs, which is very, very vital, very, very important to orthopedics. So this is what is known as a DMARDs. So DMARDs are fully known as what? Disease-modifying anti-rheumatic drugs. Right? So we're not talking in-depth on any of the drugs. We're just trying to look at an overview. Right? In-depth lectures on this will come when we start any pharmacology. But if there's any of the drug which you actually want to know about, it's a pressing need to know about it, you can just comment and I'll direct you. Okay. So for the disease-modifying anti-rheumatic drugs, just so you know, they're actually a powerful class of medication, right? So they are used to treat what? Autoimmune and also inflammatory conditions. So any condition that is making your joints to become inflamed, rheumatoid arthritis, psoriatic arthritis, lupus erythematosus, ankylosing spondylitis, all those inflammatory conditions, right? So unlike pain relievers or steroids, these DMARDs, like, they slow or completely stop disease progression. Do you understand? So you might feel they are similar to all those steroids, non-steroidal anti-inflammatory drugs, but they are quite different in the way they act. Okay. So for the examples, you have the conventional ones. Those ones, they are suppressing your immune system, because most of these inflammatory conditions is because your immune system is reacting to what is not good in your body. Do you understand? That's why you're having inflammation. So examples like what? Methotrexate, Sulfasalazine, Hydroxychloroquine, Leflunomide. Have the biological ones. Those ones, they target what? Specific immune proteins and cells, like what? Adalimumab, Etanercept, Rituximab, alright, tsDMARDs. Alright, then targeted ones, okay, that target various pathways, like what? Tofacitinib. Alright, this is what? Adalimumab. This is what? Methotrexate. This is what? Tofacitinib. I just brought some 1 or 2 pictures, right? I told you guys I will talk about them fully. I have the Baricitinib, I have the Upadacitinib. Okay, so how do they work? Most of them, they work by what? Suppressing your immune system so that it's not overreacting, causing all those inflammations that come up. They reduce inflammation and joint damage. They help to maintain mobility and function of the joint. They delay the disease from what? Progressing, or they completely stop it. So common side effects when you are using these drugs include things like this: increased risk of infection. Why? They are inhibiting your immune system. Do you understand? So on the other way around, if you have an attack, so liver enzyme elevation, blood cell count changes, gastrointestinal issues like nausea, diarrhea, injection site reactions too.